when you first encountered Maya and her family, you performed an admission assessment in the PICU.
I did.
Can you please tell the jury what an admission assessment is?
An admission assessment is a complete, like it's a profile of the potential needs that the patient is going to have when they're in the ICU. The admission assessment will be things about pain history, if there's any spiritual needs that they may have, their regular diet, any safety issues, who lives with them, their whole background. We do and keep that profile of the admission assessment.
And part of that assessment is obtaining a history.
Yes.
And who was it that provided you with Maya Kowalski's medical history during your admission assessment that day?
Mrs. Kowalski was at my side right here. I was at the computer like right here, and Mrs. Kowalski was reading the computer with me, and she was giving me all the information, like answering the information with me.
Did you observe any language barriers when communicating with Beata Kowalski?
No, there was none. Mrs. Kowalski was a nurse herself. She knew medical terminology. There was no, she was proficient in English. There wasn't any communication.
Now, moving a little past the admission assessment, do you have any recollection about difficulties with obtaining vital signs for Maya Kowalski on October 7th?
Yes. When a patient comes into the ICU, we get a full set of vital signs. We get their height, we get their weight. If it wasn't done in the ER, sometimes we'll do it again. But Mrs. Kowalski would not let me take a blood pressure on Maya. She said it was going to cause her pain. And I said, well, we need to have a blood pressure done on her. And she said, well, if she has blood pressure taken, that she needs to be pre-medicated for the blood pressure. I'd never heard that in all those years. I'd never heard of it. And I knew that they said that she had pain, but I'd never heard, and I've had patients with pain issues, kids with cancer and things, but she needed to be pre-medicated. And so we held off on it for a little bit. I was able to put her on the monitor. I was able to see her heart rate and her respiratory rate, her oxygen saturations, that's how much oxygen her blood had. Those were really, that was critical to have that part. And we deferred the blood pressure for a little bit until I can talk to the doctors and see what do we do to give her pain medication for the blood pressure. So we held off on that for a little bit, and we're going to revisit that.
Now, am I correct that you had the opportunity to observe Maya Kowalski at various points on October 7th?
Yes.
Do you have a recollection about Maya's mobility within her bed while she was in the PICU?
Mrs. Kowalski told me that Maya can't walk because of her CRPS. And I took her at her word for that. I mean, that was okay. I understood she had some issues, medical issues in the past and now. Except then I saw Maya was on her knees on the bed, and she was moving around on the bed on her knees. And I was like, Maya, you're moving on bed. You're and in the hospital, it's hard to move on your knees on a bed, on any bed. It takes a lot of strength to do that on a air mattress. So with these air mattresses, you sink into the bed, and to be able to move like that while you're sinking, I thought was a little bit suspect. Like, how did you do that when you can't walk? You had your legs were so profoundly weak, but she was able to do that. It's like walking on a moon bounce on your knees. It's hard. So I did mention to Maya, like, Maya, look at, you're doing good. You're doing good. Maybe you could do something. You could walk. Maybe you can try. So I did notice that was unusual.
And at various times from your vantage point while observing Maya Kowalski, were there times that she appeared agitated?
Yes.
Or were there times that she appeared upset?
I'm sorry?
Were there times that she seemed upset?
Yes.
Did she appear withdrawn at times?
Yes.
Were there times, though, that you observed her that she didn't appear upset, agitated, or withdrawn?
This happened most often. It happened very often. And this was strange too, is because Maya's behavior did change when she was alone with me, or even the other, as I was charged and the nurses would give me a report, they would say the same thing. And I saw this, that when Maya was with her mother, she was a different girl. When she was alone, she could be very sweet, age appropriate, 10-year-old. And she would be a nice little kid. And when Maya's mother came in, the whole demeanor changed. Things changed. And she shut down. She became withdrawn. And that happened consistently.
When you say consistently, can you approximate how many times over the afternoon of October 7th you observed this change in demeanor based on who was present?
So on October 7th, when that happened a couple times. There was one time when I was having a conversation with Maya and she was talking to me. And then her mother came back in the room and everything just stopped. She shut down, and it happened then. I don't remember how many times that day that happened, but I remember distinctly that happened. And it happened again on other days in the ICU.
And did you have the opportunity to observe Beata Kowalski's demeanor and behavior in the PICU on that day, October 7th?
Yes.
And how did Beata Kowalski behave in the PICU?
Mrs. Kowalski, when she came in from the beginning, I don't know why. Mrs. Kowalski was very agitated as soon as she came in. I felt like I was starting to walk on eggshells, like she was demanding. She wanted this. Even when I was doing that medical assessment or the hospital intake and assessment, she was right there answering the questions. And I was thinking, okay, maybe that's all right. People don't usually do that, but okay. But she did control the whole thing as I'm going through checking. And it was, I could have said, hey, why don't you just answer all of this? So she was very demanding. And I just felt like she became agitated. And if I didn't do what she wanted, then she would be agitated.
At any point, do you recall any swearing or yelling in the PICU that day on October 7th?
There were a lot of F-bombs that had happened in that day. I don't remember all the specifics, but I remember the swearing started. Yeah, I do. I remember actually with both of them, with Maya and her mother, that there were a few F-bombs.
Do you recall at any point Maya using profanity directed at any of the staff members at Johns Hopkins All Children's Hospital?
I do.
Why don't you tell the jury about what you recall?
So I was charge nurse on that day when it was directed at the staff that I witnessed. So in the hospital, in the ICU, we have like a morning rounds, and you have the team together, and there's the residents, and dietary is there, pharmacy's there, nursing's there, everybody is there. When we go to the patient into the room and then talk about what happened that night and then what the plan is for the day. And I was the charge, so I go along with the rounds to each patient. And we walked into Maya's room, and Bea Tepa, Dr. Tepa, was the attending that day. So we had just walked in, and I think she said something like, "Hi, good morning," and she's like, "Well, we're something along the lines of like, we're have a new day, or we're gonna, talk about your plan of care," which is what she normally says. And then, Your Honor, is it all right if I say it?
First, objection to hearsay. Second, narrative.
Sustained.
And not responsive to the question. Move to strike the last 10 lines.
Just ask your next question.
Why don't you tell the jury about the incident where Maya Kowalski used profanity in your presence?
Well, in my presence, so she was saying the F-bomb. I want my F in I want my effing sedation. I want my effing sedation. Then she called Dr. Teppa. She called it, I was there and she called Dr. Teppa an FNAH. She said, shut up, you FNAH.
Was that
Such-
something that you found unusual in your experience as a PICU nurse?
Yes.
And why was that?
Well, here's this 10-year-old little girl. It was unprovoked. Like, it was a morning, we just walked in. I don't know why that happened. I don't know where that came from, but she said the whole word and we were shocked. I was shocked. I saw Dr. Teppa's face. It was like, I don't think anybody had ever said that to her. She gasped and we all looked at each other and were in shock.
Objection, non-responsive to the question.
Overruled.
Ms. Klink, I'd like to now go through a few of the entries that you made in Maya Kowalski's medical chart the afternoon and evening of October 7th, okay? Clay, can you please put up Joint Exhibit 1001 2722? It is in evidence. And I'd like to draw your attention specifically to the note here from 1700. It's under the text note T900. It says, I want my sedation. I want to eat. I feel like I'm having a heart attack. Mom replied, well, honey, if you have a heart attack, at least the doctors will treat you. Do you see that, Nurse Klink?
Yes, I do.
And is that a note that you entered on October 7th?
Yes.
Why is it that you put that entry into Maya Kowalski's medical chart?
Well, there were a couple reasons why I put that. Secondly, I thought it was unusual that she said, I want my sedation. She didn't say, I'm in pain, nurse, my arm hurts, mom, my leg hurts, my back hurts. I'm in pain. I have an owie. Somebody help me because it hurts. She said, I want my sedation. And I thought that was unusual for a 10-year-old. Kids don't ask to be sedated. They ask for something because they have something hurts. They have an owie. They have something bothers them. They'll say that, but they don't ask for sedation. So that I thought was very strange. So I put that in. And then the other thing is,
And I was going to get to the next one, Nurse Klink. There's a second note here, T901 from 5 p.m. on the 7th. It says, well, can you see it? We've got it highlighted here for you, I believe.
yeah.
Quote, I'm tired of all these lies. My life is a lie, end quote. Clay,
Yes.
can you highlight that, please?
Objection, reading from the record. Strike.
Let's try not to read the records.
Nurse Klink, do you see the entry here that's highlighted
Yes.
before you? Can you tell me, or describe for the jury rather, what was going on around the time that this statement that you quoted from Maya occurred?
I was alone with Maya in the room in her hospital room when this happened. She was saying that she was hungry and she wanted a donut, but she said about the sedation part. And then she said, I'm tired of all these lies. My life is a lie. That struck me very hard. I don't know how to explain it. When she said that, it sounded to me like it was a cry for help. Like there was she was desperate. She said those words to me and I said, Maya, what do you mean by that? And Maya's, before that happened, Maya said to me, where's my mother? And I said, well, I think your mom is with the doctors. They're having a meeting. And then she was saying, I want my donut. I want my sedation. And then she said that. So Mrs. Kowalski and I believe Mr. Kowalski were in a meeting with the doctors. This was right after she was admitted. I think this was like soon after she was admitted. I didn't have any background. I didn't really know that much about Maya. I certainly didn't know anything along, like now that I look back on this, but that struck me as very, very unusual. It was like a cry for help. I don't know. So I put it in there, and it looked like she was about to answer me. And I remember distinctly, she paused when I asked her, Ryan, what do you mean by that? She paused, and then she looked like she was about to answer. And then Mrs. Kowalski came in the room, back from the meeting with the doctors. And then that was the end of it. And this was the first day. This was right after she was admitted to the ICU. And I thought it was unusual for a 10-year-old to say, I'm tired of all these lies. My life is a lie.
What do you mean the end of it? You just told the jury that when Ms. Kowalski came back in.
Well, that was the end. Maya became withdrawn again and kind of shut down. And I went back and did the rest of my work, checking on meds or whatever. But that was the end of it. That was the end of the conversation. She said that. I asked her to explain more. It looked like she was about to, and then her mom came back.
In your almost 20 years of nursing experience now, have you ever had a child tell you that their life was a lie?
Never.
Were you concerned by that statement?
Yes, I was very concerned. I mean, I don't know anybody, any kid, any child that would say such a thing. And she said that, exactly that. And that did strike me as why would you say that? What does that mean? That meant something. And I could see she said it.
Going back to your entry here about Maya requesting sedation, do you recall the tone of her voice when she was asking for sedation?
Maya was agitated. She was angry. She was yelling. She would say, I want my effing sedation. She was upset. She was agitated.
In your years of nursing experience, have you ever had a 10-year-old ask you for sedation?
I've never had any child ask me for sedation, to say, I want to be sedated.
Now moving forward, after you were the bedside PICU nurse on October 7th, am I correct? You were the charge nurse on the PICU for a series of days after October 7th?
Yes,
And you were charge nurse for a few days while Maya Kowalski was in the PICU, is that correct?
correct.
Can you please describe for the jury some of the recollections you have serving as a charge nurse during those days while Maya was in the PICU?
Objection calls for narrative answer specifically.
Sustained.
During the period of time that you were a charge nurse on the PICU, did you have any interactions with Maya Kowalski or her parents?
Yes.
Okay, can you please tell the jury what you recall about those?
Objection again, narrative. Overall take time.
You can answer.
Can you repeat that last part?
Yeah. So during the period of time that you were a charge nurse in October in the PICU, can you please describe some of your interactions with Maya and her parents?
I was in one of the care conferences.
And let me stop you there. I'll represent you. There was a care conference on October 11 of 2016. Does that sound about right to you?
Yes.
Okay. And why don't you explain for the jury what a family care conference is?
A family care conference is when you get the different teams together, and sometimes there's discharge planning. You get the different teams. Sometimes if it's a child with lung issues, then the pulmonologist would be there. The charge nurse is there. The physicians are there. The parents are there, and that's what care conferences is, where you get everybody together all on the same page at the same time and figure out a plan of care.
And what do you recall about that meeting?
I remember it was in the morning. I was charge nurse that day. I was there as a observational. It was the physicians were there with Mr. and Mrs. Kowalski. And I remember that the ICU team were talking with the parents about the plan of care, what they're going to do with Maya's care. And I know that they were working towards trying to get Maya into some type of a stable medication or stable regimen where she wasn't on a lot of these ICU meds. Some of these meds are dangerous meds, and to try to wean her off those meds and get her into some other type of like a therapy, cognitive therapy, maybe just some try to get her stabilized on that and take her down from a lot of these ICU meds that were like ramping up.
And what do you recall about Mr. Kowalski and his position about what the doctors were requesting and recommending during that care conference?
Mr. Kowalski and Mrs. Kowalski were sitting kind of on this corner. I was right here. And he said to her, he's like, I think this makes a lot of sense. I think we should do it. I think it's reasonable. Why don't we give it a try? It's what they're saying. It's okay. We should just try it and just see it. They seem like it seems like it's a reasonable plan.
Narrative answer. Objection, motion to strike. Sustained.
Okay. During this conversation, the care plan conference, what do you recall Ms. Kowalski saying in response to Mr. Kowalski's request to stay at the hospital?
Say that again.
At this care conference we've been discussing, what do you recall about what Beata Kowalski was saying in response to Mr. Kowalski's suggestion that we listen to what the doctors at All Children's wanted to do?
Mrs. Kowalski did not want to entertain any other plan other than continuing with the ketamine and the propofol and the ICU drugs.
Did it appear to you as though Mr. Kowalski wanted to have Maya Kowalski stay at Johns Hopkins?
Yes.
And at the end of the care conference, do you recall if the Kowalskis agreed to stay or not?
I believe they did. That would, you'd have to check on with the physicians to find out the final, but I believe that, yeah, they stayed. They chose to stay.
Do you recall during this family care conference on October 11 of 2016, any threats to the Kowalskis that they would be arrested if they didn't stay at All Children's Hospital?
No.
Have you ever, in 20 years of nursing, heard any hospital staff member threaten a parent with arrest if they wanted to leave against medical advice?
Objection, foundation, predicate, and
Sustained here, and let them come forward.
And what do you recall about this incident where Mrs. Kowalski was requesting propofol?
I don't remember all the specifics. I know that she wanted propofol. I don't know why. I mean, it's usually a sedating agent, and I remember thinking it's for sedation. And I don't know why Maya would be sedated, but she kept insisting she wanted propofol, and I thought that was unusual to have for propofol in that situation.
Were there ever times that you recalled Mrs. Beata Kowalski requesting sedative drugs around the time that Maya was about to go to sleep?
Yes.
Did that strike you as unusual?
Yes. And there was a couple.
Objection, foundation, predicate, knowledge, all of that.
Overruled.
You may answer.
So there was a couple times when Mrs. Kowalski wanted me to give Maya some pain medicine. And one time she said to me, she's like, one time, Maya was almost asleep. Her eyes were drifting off. She was resting comfortably. And Maya, or Mrs. Kowalski, went to Maya and like to wake her up and said, Maya, are you in pain? And I thought, oh, you don't wake her up. She's sleeping. And that was one time that she did it. Another time she was saying, she's in pain. She's in pain. You need to give her pain medicine. And normally, I will work with the parents 100%. I had been in ICU for a long time, pediatric ICU for a long time. And I work with the parents if they think that. But this time this was different. She was saying, she's in pain. She's in pain. And I really didn't want to get involved. I didn't want to answer because I just thought she was not in pain. And then Mrs. Kowalski said to me, don't you see she's in pain? And then I thought, okay, she actually asked me then, and then I looked at Maya. Maya was completely calm. She was quiet. She was laying in bed comfortably. And then I looked up at the monitor, and I see she has the low resting heart rate. She had a low respiratory rate. And I said, no, I don't see she's in pain. And that was unusual for me because, like I said, I don't want to be stingy. I treat pain very seriously. I especially treat children's pain very seriously. But it was obvious that Maya was comfortable, and I could tell not only was she resting, but you can see on the monitor her heart rate and her respiratory rate were low. And if I give her pain medicine, that can bring her respiratory rate down too low. And yeah, that struck me as very, very odd. I was nervous to even go ahead and do that because if somebody's really in pain and their heart rate comes down from 150 to 120, that's okay. But if the heart rate is 70, 80, and now I'm bringing that heart rate down because of the pain medicine or the respiratory rate, now we're in trouble. So yeah, that kind of stuff was happening. And then, yeah, that was distinctive to me. That stuck out.
Nurse Klink, from your vantage point as a PICU nurse, were you concerned for Maya's care and well-being when she came into the hospital on October 7th?
Of course.
Thank you. Your witness.
Wow, with all that experience, you must have been really good at charting everything that was important, right?
I chart what I can get in there. Yes.
And what's important, right?
Mhm.
Really, if something astonishing happens, you're going to put it in there, right?
Nurses chart as much as they can get, as much as they can chart, as long as they're doing their patient care as well.
Well, why is it that, and I can approach and show the witness, from in all of your charting here over a few days, most of what you said about all the words and all the actions is never charted. Why is that?
Well, first of all, we do chart all the vital signs. We chart the meds. We chart what goes in the patient. We chart what comes out of the patient. Those are things that we for sure, we chart, we get in there from the medical point of view. The other stuff, if we can get some time to put the things that some of them are glaring. The incident with Dr. Tepa, where she called her that name and she said the whole words, the whole thing. I only gave the initials, but she said everything. The reason I didn't chart that is because most of our charting that we do for that is a communication tool in the hospital. Like I wanted, if we chart that the patient got out of bed, because when physical therapy comes, they will look at the child's chart and says, oh, okay, the kid was out of bed today. So something like that is what I would convey to the ICU team, specifically to the attending that's there. And Dr. Tepa was in the room. So this was during rounds. Everybody was there. Anybody that needed to know about what that kind of those expletives, anyone was already there. There would be no reason for me to chart it. If I thought that I was going to be here where I am now, yeah, maybe I would have charted it. But Dr. Tepa knew. We all knew. I'm not going to. It's more, that kind of stuff is for the purposes of communication in the hospital. I didn't think I'd be here.
Anything else
That's it.
on your explanation? Sir?
Yeah, I chart what I can chart. I mean, there's 12 and a half hours that we are there in the bedside. We are running. We're monitoring the patient. These kids are critically ill. We don't chart everything that's a communication that comes out like that. And like I said, the thing with Dr. Tepa, yeah, maybe I should have, in retrospect, if I knew I was going to be here, but at the time, anyone who needed to know was there.
Aren't you allowed to have either your phone or a cell phone from the floor on you as you make your rounds?
I believe we are where we were.
Why is it, after 12 hours of all of this, there isn't a single photo or video or surveillance or anything else that confirms what you're saying?
Well, there's no cameras in the room. This happened in the patient's room, right? They don't have, unless they need to put it up for a specific reason, but there's cameras in the halls. And we're not allowed, I don't take pictures of any patients. We're not allowed to take pictures of the patients. I don't videotape the patients. I don't do that.
I
That's
see.
it.
So you nurses are not allowed to take pictures of the patients, right? Isn't that what you just testified to?
Yeah.
Okay. So I guess taking her into a room and stripping her down to her bra and her shorts and taking about 8 to 10 pictures of her, that would not be appropriate, would it?
Objection form, overall form, foundation. You can answer.
There are times when there are pictures taken. Absolutely. They are taken for purposes, for medical purposes, 100%. And that's undeniable. But for me to just do it on my phone, to take a picture of the patient, I don't have any reason to do that. If it was a medical reason that somebody needed to do that, that does happen. That I know happens. People do that. I know different entities will do that. But as the nurses, no, I don't take a picture of a patient on my phone. Maybe unless somebody else has a reason to do that, possibly, but I don't. I'm answering for myself. What other people do is you'd have to ask them.
Anybody, anything else?
No.
You'd like to add? Okay. So if somebody were, say, to take a child and put them in a room and videotape them without their parents' consent or their consent, that would also be something that would be against your policies. Agreed?
I disagree.
So it's okay to videotape children without the parent's consent or anyone's consent but you, correct?
That's not what I said.
Well, if it's not the parent's consent and it's not consent from another authoritative source, that leaves you, right? So-
Argument sustained.
So do you or do you not have the authority to do what I just described? Take a child into a room under false pretenses of an EEG and put her in that room, video her without her knowledge. Oh, put a commode just out of reach to see if you can tempt her to get over there. So who gives the authority to do something like that?
Objection, argumentative, compound, foundation, sustained.
Are you, do you work with Kathy Beatty at all, ever?
I did in the past,
Not anymore,
correct,
not since she left, right?
correct.
And before that though, was she a PICU social worker?
Yes,
Were you a PICU nurse?
yes,
So you saw her about every day, right?
no.
How often?
Maybe once a week, once every 2 weeks. And if she had a patient that involved me, we had the same patient at the same time, then I would. But if I had a patient that Kathy Beatty wasn't working with, then
Okay. So with as stunning as all of this is, I mean, with a 10-year-old Mike Kowalski throwing around words like this, you would have mentioned that to Kathy Beatty, right?
Objection, argumentative. Rule.
You can answer.
no, not necessarily.
Well, wasn't she assigned to Maya and to move between floors with Maya?
I'm not sure what happened on the floor. I don't know if she was assigned on the floor. I don't have no knowledge of what happens on the floor. I don't know. I didn't recall. I don't recall telling her that. I don't recall. You mean when Maya was swearing?
Yeah, any of that stuff.
I don't recall telling Kathy. I don't know why I would tell Kathy. I would tell Kathy if there was a need for maybe some social services, but to go around and no, I didn't see her. I don't remember seeing her to do it. Maybe if something came up in conversation, but I don't recall telling Kathy Beatty. And like I said, the people, the people that were there knew, and that was kind of it. I didn't start telling everybody. What
How many
happened?
nurses and social workers worked in that PICU at that time? We're talking about the fall of 2016.
Oh, I don't know, probably 40 nurses.
And there are nursing stations at different points, or just one nursing station
There's different points. We're spread out.
on the floor, right?
Mhm.
And so you're telling the jury, after all of this astonishing behavior, it did not spread to every single nurse and social worker on that floor.
Not only do I say I'm not surprised that it did not. It should not have spread to everybody on the floor.
Okay. So you don't think anybody else on the floor heard about it?
I didn't say that. You said everyone on the floor. No, I don't. The ICU is like a dumbbell. There's an area here, and then there's an area here, and then there's like a long hallway. This side doesn't really communicate. This is the east side, this is the west side, and then there's a few rooms down in the middle. No, we don't communicate. So the half of the unit is not going to hear what's going on in this unit, on this side. And no, there's a lot going on. People have a lot of their patients. They have these sick patients. Some kids are I mean, very sick. It's hard to explain unless you're there. I mean, some kids are on ventilators. Some kids are dying. Some kids are close to that. And yeah, maybe people over here.
Residents and everyone else in that room, no one else charted this in over 1,500 pages of medical records. Do you know why?
Yes.
Tell me why.
Because everybody, it's a need to know basis. ICUs with hospital, it's from our point of view, it's a need to know basis. If they didn't need to know, it didn't need to go in there. The doctor knew, I knew, the charge nurse, when I was charged that day. It didn't need to be told throughout the hospital and in the record. It's not something we would put in there. The things that we put in there, like I said, is more for communication back and forth, that the child ate this or whatever. And especially like in the beginning as well. Nobody knew that we would be here. And she most certainly said that. I mean, 100% she said that. But I wouldn't necessarily chart it. Not necessarily. There's no need for me to put that in there. Hindsight's 2020, and we look back and say, okay, now we're here. But at the time, nope, it was not something that would go in a chart.
Well, did you all tell risk management this, or was risk management already involved?
I don't know that. You would have to ask risk management. I don't know when risk management was called. I didn't call risk management.
Were you there when Estepa Sanchez called risk management?
I was not.
Did you talk to risk management at any point?
I don't believe so. I don't recall. I don't recall talking to risk management.
All right. So Ms. Winton came down, you never talked to her,
When who?
wasn't it? Yeah. Ms. Winton.
I don't recall that.
Okay. Somehow though, risk management found out. Did it come to your attention?
Mm-mm.
Let's see. All right. Well, you charted on numerous occasions that Maya was a 10 out of 10 on pain. Did you not?
I would have to see the charting and see what that was.
Scale. Do you remember any of the scores you gave for that?
Not offhand. I'd have to see it.
Okay. Well, I'm trying to find the actual number, but you did Okay. You did charge, grimace, frowned, withdrawn, that ring a bell. You did, chart frequent chin quiver, clenched jaw, grimaces.
Your Honor, we'll object. We would appreciate it if the witness could see what Ms. Anderson's agreement on.
If she wants it, I certainly will show it to her.
I do remember when I was doing the nursing admission assessment, and Mrs. Kowalski was at my side. And when we got to this part with the pain, Mrs. Kowalski is the one who told me, yes, that, and I remember that distinctly. So I don't know. So she told me when I first came in, like, we asked all the, the parents, but this time Mrs. Kowalski was next to me. Usually the parents are like on the couch or something, but, and I'll ask the parent, how does the child convey pain? Some kids will, bite on their blankie or whatever. So we ask the parents so that we know what to look for. And that's where that originated. So Mrs. Kowalski told me when she first came in, we were checking which boxes to check.
Do what?
Which one?
1001. Now, you've got, I believe, you've testified to about all of those. Is it your testimony now that Beata Kowalski told you to put all those down?
And Mrs. Kowalski told me when she first came in, when I asked, how does Maya exhibit pain? And she went through each one and said, yes, this one, this one, this one, this one. And so then I continued on that that's how she exhibits pain. Yeah, I didn't see her frequent chin quiver, but I know Mrs. Kowalski's like, yes, this is a firm this. And so I did it.
Okay.
I mean, I didn't say punch jaw. She told me that that's how Maya has those pain.
All right. So now you charted out, and if we can pull it up, 1001-1056, the nasogastric tube. Got it up? What's a nasogastric tube?
It's a feeding tube that goes into the nasogastric, so nasal is the nose, goes into the nose, and then it drops down into the stomach, and then they're fed formula through that.
Okay. So then what may have happened then is that when Mrs. Kowalski walked in, she was a nurse, right?
Correct.
You're a nurse, right?
Right.
Mrs. Kowalski was very dominant about what was best for her child, right?
Objection calls for speculation.
Repeat that.
Mrs. Kowalski was very dominant about what she wanted for her child, right?
What she wanted for her child, yes.
And she told you what she wanted for her child, right?
Mm-hmm.
She told you, a nurse, what she wanted for her child, right?
Yes.
But you didn't always agree, did you?
When Maya first came in,
I'm just asking you whether you agreed or didn't agree, ma'am.
did I agree? What did I ask me the question again?
All right. At times, you disagreed with what Ms. Kowalski wanted to do, did you not?
Yes.
But she still insisted, right?
Yes.
And this was on the PICU floor?
Yes.
During the care conference, was Ms. Bagby there?
Who?
Nina Bagby?
I don't know who that is.
Do you recall the security people outside the door during your care conference?
I don't recall security inside the door.
You don't recall two security guys standing on either side of the door during that care conference?
Well, I was inside, so if they came after I was inside, I don't know, I don't recall seeing that. No one told me the security was out there.
Actually, what happened was that Maya Kowalski was in extreme pain when she came in, wasn't she?
Mrs. Kowalski said that Maya was in extreme pain.
It was
Yes, but you're asking me if I thought Maya was in extreme pain. There were times when Maya's heart rate was so low, she was resting, she was half asleep, and the mother was yelling, actually in my face one time, saying, "She's in pain, she's in pain."
right.
And no, I did not think she was in pain. She was quiet, she was half asleep, and her vital signs were showing on the monitor. So Mrs. Kowalski may have believed, I don't know what she believed, but she said her mind is in pain. And then she asked me and she says, "Don't you see she's in pain?" And I said to Mrs. Kowalski, "No, I don't."
1001
Ma'am,
dash
can you
2,
just answer the question that's asked?
Yes.
Thank you.
1001 dash 2326, please. Who's Elizabeth Sumner?
She was an ICU nurse.
Experienced nurse or not?
She was a charge nurse at one time, so yeah, I don't know.
Yeah, you see her ranking it at 10 on the pain scale?
Yes.
And then you go down a little bit more, and there's another 10 on the next entry. One says like apparently she was asleep, but on the under over awake and alert it says 10. See that? And then we go down to Elizabeth Sumner, a 10. Do you see that?
Yes.
Do you see under Kelly Thatcher a 10? You see that?
Yes.
You see then under Kelly Thatcher an 8.
Yes.
And I apologize. I said you were in the 10s too, but yours was a 7 and then a 6, right?
Yes.
And then a 7 and a 6, right?
Mm-hmm.
Okay. So apparently she got in more pain during the time because Sumner and Thatcher were on the 8th the next day, right?
Yes.
So would you agree with me that many people felt Maya came in with a 10 on a 1 to 10 scale in pain? One 001 dash 2450. Maya was also, when she came in, inconsolable, was she not?
Mm. I wouldn't say she was. Maya was yelling.
Mm-hmm.
Yes.
Doesn't it say inconsolable?
Well, those are the options they give us.
I see. And then I believe you gave Maya, or excuse me, not you necessarily, but the care team there gave Maya a number of different medications, right?
Yeah.
And those medications included not only the ketamine, but you also gave her tramadol. Is that right? And then, where's the meds page? I'm sorry. If I can find it, I'll show it. He'll find it. All right. In the interim, let's pull up 2045-024. Well, hold on for now. What actually happened was Maya received some medications, right? Then it tried to snake a nasogastric tube down her nose, right?
I don't recall that.
Yeah. And once you tried to snake a tube down her nose, she rebelled, right?
Objection to the extent counsel is testifying and not showing the witness the records.
I don't recall that.
You don't recall having to put somebody else having to help you hold her down while you snaked a tube down her nose? Now that comes back?
No, we do those a lot.
Uh-huh.
I don't recall that. I don't.
And in fact, once people started to grab her and put something down her nose, she really went wild, didn't she?
I don't recall a feeding tube and putting a feeding tube in there.
She went wild because you were hurting her, correct?
I don't recall putting a feeding tube in Maya.
Okay, well. One zero zero one dash 1056. No, that's not it. It's a two set. It's 10012722. I apologize.
I'll object that note has nothing to do with this witness.
Can you find that too? It's on the narrative on the top. Now putting the tube down her nose. Did somebody else do that?
I don't know.
What actually happened here was that Beata Kowalski challenged you, right?
Objection argument.
Oh, sorry. We're back. Okay. Please take a look on your screen. Does that say nasogastric tube?
Yes.
Objection again, this document has nothing to do with this witness.
And her name on the bottom, can we just go with legal objections?
Objection foundation.
And what's the time?
That's her name right there. You can continue, Mr. Anderson.
Well, it says I reviewed it.
Okay, so you stepped out while they were putting the tube down her nose?
I don't recall doing that. I don't know where the documentation is, who put it in. I mean, if I put it in, possibly, but I'd have to see the documentation because this just says I electronically signed it.
Well, how'd your name get on there?
Because the order came through, but it might not have been done. That if the order came through at 13, somebody put the order in at 13:04. At 13:19, I saw the order and signed it. But that doesn't mean that the tube went in at that time. That means, okay, yeah, I see that there's an order. I don't know when the tube went in. I don't remember doing it. I put hundreds of tubes in. But I don't know that about if I did that or not. I know I signed it, but that's it.
Anything else? All right. So once you or someone, while you stepped out momentarily, put the tube down her nose or tried to, and held her down to do it, Maya went wild. So when you came back in, you saw her flailing and screaming, right?
Objection argument.
Is that true or false?
Foundation.
I don't recall that.
Okay. And then after that, there were some cursing in the room, but it wasn't Maya, was it? It was other people in the room trying to hold her down, wasn't it?
I don't recall any of that.
And after that, were you the one that started kind of the narrative that Beata was nuts?
No,
Weren't you and Kathy Beatty telling everyone on that floor, watch out for this mom, watch out for the kid? They're a little crazy.
no.
Sorry, Tom. You're ready.
Nurse Plank, you remember some questions about pain scores that were entered in the chart?
Yes.
If somebody puts a 10 down on a pain chart, is that something that the patient reports to the nurse?
No.
Okay. So,
Well, if you ask, it depends. If you ask the patient, and you could ask the patient on a scale of 1 to 10, and then they can tell you that it's a 10. It depends if it's a small child, then you use different methods. Maya would know a scale of 1 to 10, so it's possible, most likely, that at her age, she was asked on a scale of 1 to 10.
and I think you made it clear, but you don't have any recollection of placing a nasogastric tube down Maya Kowalski's nose.
No, I don't.
Anything further?
No, Your Honor.
Jury? I see you're already packing up, so do not discuss this case amongst yourselves. Do not do any investigation. Receive no information.